Welcome back to the Holistic Feline and Friends podcast, home for all things holistic and healthful for our pets. I'm your host, Angela, also known as the Holistic Feline on Instagram. Fellow producer Fred is here with us. In this episode, we discuss a topic that has touched about every soul on this planet in some way, shape, or form. I know it's near and dear to my heart, a topic that holds many emotions that usually lead to grief, guilt, hopelessness and helplessness, confusion, disbelief, and often shock. We are talking cancer. Cancer in pets and people. I invited board-certified and integrative veterinary oncologist, Dr. Kendra Pope, to shine a light on the subject. She is a true pioneer in veterinary and integrative oncology, notably one of 4 in the United States and quite possibly the world. Creme de la creme in the field. We are discussing cancer in pets, creation, prevention, and holistic intervention. We also touch on a hidden contributing factor in cancer creation, emotional health. It's a powerhouse episode. This episode, along with episode 4, 6, and 9, are dedicated to my soul kitty monkey Bean, who I lost to small cell intestinal lymphoma in 2017. I miss you every day of my life, and I am forever grateful for your love, lessons, guidance, and our journey together. May our journey together continue, and may we continue to help others along the way. With love to you, Monkey. I am honored to bring to you all today a resource and knowledge I wish I had back then, in hopes to prevent our story from becoming your story. Knowledge is power. When we know better, we have the choice to do better. Here is the Dr. Kendra Pope. Welcome, Dr. Kendra Pope. We are so honored to have you. You're leading the way, a true pioneer in integrative oncology, and we are so happy to have you here. We're discussing a topic that has touched many people on this planet. I know it's near and dear to my heart. I lost my soul kitty to cancer in 2017, and my world has never been the same since. And so to have you here to share your expertise on the topic of cancer in pets means the absolute world to me. Thank you for being here.
You're welcome.
May we begin with a self-introduction, who you are and what you do?
Yeah, of course. So I'm Dr. Kendra Pope. I'm an integrative oncologist, which means that after veterinary school, I went on to do an internship and residency in oncology. So I did 4 more years of school. I guess I'm a glutton for punishment. And I studied only cancer for 4 years after veterinary school. During that time, I enjoyed it. I really liked learning all about it. I'm someone who needs to know everything there is to know, but there was always a part of me that wanted to learn outside of the box treatments and always knew that non-traditional therapies were going to be a part of my practice. And so over the last 15 years, I've spent basically all of my free time learning more and more about these tools that are considered non-traditional and holistic or natural. And so now my entire practice uses all of these tools. None of my patients get just conventional care. They all get all of the tools in the toolbox. And so this is something that, as probably most pet owners would imagine, is not common. There's actually only 4 of us in we think probably the whole world, but definitely the United States. And we're the only ones that are truly devoting 100% of our practice to treating cancer with all these extra tools. So it's been a super fun journey, and it's been really exciting to kind of be one of the pioneers in this field to share this information.
It's really wonderful. Later on, I will share a personal story about Monkey and I wish I knew of you back then. So It's really great what you're doing, and I thank you.
Sure.
So I'm going to kick it off with a very basic question. What is cancer?
Well, that's a good question because I feel like everybody assumes they know the answer to that, but I like expanding on this and busting myths. That's kind of like my MO. So I think that cancer is believed to be like this external invader, to be this enemy, to be this thing that we have to wage a war against and that we have to burn and poison and cut out and to kind of separate from ourselves. But what cancer is it's just our cells. It's our cells that are alarming. It's our cells that are telling us that something's wrong, that there's an imbalance, that there's a nutritional deficiency, that there's inflammation, that there's oxidative stress, that there's metabolic changes. And it's trying to alarm us and tell us that something's wrong, because that's what our body does. It's very, very intelligent. It's very, very sophisticated. And when something's wrong, it tells us something's wrong. But when the body is unable to hear it, or the body is unable to fix it, it can go on for too long and create these cells that have become so abnormal, they've forgotten who they are. And in forgetting who they are, they grow uncontrollably. They utilize metabolic substrates and sugars differently than other cells, and they don't behave the way that they're supposed to. And in doing that, they actually can take over and they can kill the host. And so although it can become something that we need to be aggressive with and that we need to address aggressively, all that they are our normal cells that have lost kind of sight of who they are and what they should be doing.
That is light on the subject there. So I know cancer doesn't happen overnight. Can you break down how cancer is created in the body?
Yeah. So this is also something that is a huge myth that we're led to believe. Whether you're a person who knows a human who's been diagnosed, whether you're a pet parent that's had a pet who has been or is currently diagnosed with cancer, a lot of times the narrative sounds something like, I don't know how this happened, or they were healthy a month ago, or I just had an exam, or my blood work was all normal. And it seems like this thing where all of a sudden came out of nowhere and we can't imagine what happened. But the reality of the situation is just like you mentioned. It usually takes many years to develop. And there's actually evidence in both animals and people that in people, it's an average of somewhere between 10 to 25 years for cancer to develop. And for animals, it can be between 5 to 10 years. So there are things that have been happening ahead of time that our conventional diagnostics cannot detect, that are kind of flying under the radar of our usual things like blood work and x-rays, but that are happening all the time that are then leading ultimately to have a cancer diagnosis. So it can actually take many, many years for these cancers to develop, and they do not happen overnight.
And I will share my personal story here because it's so relevant to what you just said. Monkey Bean, who I mentioned, is my soul kitty that I lost to small cell intestinal lymphoma in 2017, began to show signs of intestinal inflammation at about 3 years of age, so 10 years before I lost her. And unfortunately, these signs was a continued theme the rest of her life. Vomiting undigested or partially digested food. And as time went on, the vomit frequency and contents changed. At times, it was projectile vomit in huge amounts, and the color changed to yellow and green with a foul smell. The veterinarians in my life at that time never once mentioned dry food as the contributing culprit. Mm-hmm. They also never mentioned a species-appropriate diet. Mm-hmm. And to this day, it still bothers me immensely. If I knew about species-appropriate nutrition at that time, I would have changed her food in a heartbeat. Mm-hmm. No one uttered a syllable about it. And so that is why it is part of my mission to announce it on the mountaintops. There is an alternative, and it's the most healthful for them. I, unfortunately, did not connect the dots until after I lost her. And in retrospect, Monkey had showed signs early on of intestinal inflammation. And since the contributing culprit was never eliminated, it progressed into chronic intestinal inflammation and then eventually bloomed into full intestinal lymphoma. Mm-hmm. That was a hard reality to confront. If I knew, I could have done better. And I felt the veterinarians in my life at that time failed me and ultimately failed her. Mm-hmm. I just kept thinking if I knew and had changed her diet at 3 years of age, maybe she'd be here with me still.
I understand how hard that is. And what I will say is that many of us who have found a place in this holistic space have a similar story, because it's where we take our pain and we turn it into our purpose. And now that that happened to you, you have her legacy to continue to empower and educate other owners so that they know that there are options and they know that there are other choices, so that if they ever find themselves in that situation, they can make different choices. Because the very unfortunate reality, and this is not just for the veterinary medical space, this is for the human medical space too, is that they weren't withholding that information from you because they were conscious of it. They were withholding that information from you because they had no idea that it exists. And it is not something that is taught, and it is actively withheld from us in our medical training because, as many people know, like big pharma controls the conventional human medical field, big pet food controls the veterinary field. And to share with you my personal story about how I ended up where I am, I lost my father at 22 to cancer after a very short, very prolonged suffering of conventional care. And I often feel the same way, that if I knew what I knew now, could I have made a difference? And so I can empathize with you how painful that is to have those thoughts. But what I can say is that now so many people are benefiting from our passion and our purpose that has come from that pain. And I completely agree with your assessment of what happened. And that is what happens. We know that's what happens. When there is chronic inflammation, we know that it can lead to cancer. And it is in recognizing that these chronic symptoms of vomiting, diarrhea, itchy skin, elevated liver enzymes, all of these chronic conditions, it's in us shifting the narrative and paradigm from these being pharmaceutical deficiencies to actually addressing the underlying cause of why they're happening and actually doing that thing instead of just medicating them. And unfortunately, both for ourselves as humans and for our pets, the medical systems are not taught how to do preventative medicine, real preventative medicine. They're taught how to medicate sick patients. The tools that we have are pharmaceuticals, and there's very few tools we have other than that, other than maybe surgery and vaccines and, medical interventions. But there is no true preventative medicine taught. And so it is in educators like you, educators like me, where we can start to share this information with pet owners so they know what to say and what to look for, so that they can better advocate for their pets, so that they don't end up in situations like you and I both have had that, now has kind of driven our purpose.
I appreciate your words. It's validating. Thank you.
Yeah.
She too, Monkey, also, I think it was maybe a month or so before the diagnosis, she had blood work and it came back perfectly okay. Mm-hmm. There was one thing that was showing low protein levels, and nobody kind of knew what that was about and where it was coming from. And then afterwards, I connected the dots with that as well. Mm-hmm. And it was obviously because her digestive system was not absorbing the protein due to the lymphoma.
Yep.
But it was a mystery at the time. But up until then, her blood work was perfectly fine. Everything was coming back normal. So just as you said, it oftentimes you're getting tests, you're getting this, and then you feel like it come out of nowhere. Mm-hmm. And I felt the same exact way.
Yep.
And felt like I was blindsided. And when I was given her diagnosis, I literally was in shock and awe and disbelief. I mean, I think probably until a few days before she passed, I did not think that she really truly had cancer. Mm-hmm. So that alone was a hard pill to swallow, because I didn't believe it. I was like, I'm going to get a second opinion and a third opinion, and this just came out of nowhere and it can't be happening. And but it did happen. Mm-hmm. So in your opinion, why do you think so many of our pets are getting cancer, and it seems at younger and younger ages?
Oh, yeah. This is a kind of topic of conversation around the whole oncology realm, whether it's animals or humans that are involved, because it's happening for all of us. So one thing that's really important for pet parents to understand is that if you're a human and you're diagnosed with cancer, it's considered what's called a reportable disease. That means if your doctor diagnoses cancer, they have to report it. And that's so that we have accurate rates and incidences of cancer so that we can track them, so that we can know what's happening. That is not necessary in veterinary medicine. There is no required reporting. And so what that means, as you could imagine, is that our ability to track the rates of cancer in animals is actually very poor. And the reason that that's a problem is because we have always assumed that the rates of cancer in animals are the same that they are in people. But is that actually true? And if it's not true, then what is going on so that something can be done? And none of that information is being collected. So that's a huge problem. So when we look at people over the last 50 years, you may have, if you're following any of this data or information, you may have started to see these reports that the cancer rate is skyrocketing, that the largest group of people being diagnosed with cancer are actually those under the age of 50. And that when we look at the types of cancers that they're getting, they're mostly associated with the gastrointestinal tract and hormone-based tumors like prostate and breast. And when they look at what the possible causes of these are, it is not surprisingly the heavily processed foods that often contain super inflammatory ingredients like seed oils. And so they're linking our horribly super toxic processed and contaminated foods, along with the preservatives and the artificial ingredients and the pesticides and the chemicals, as well as the seed oils, to the skyrocketing rates of cancer, to microbiome disturbances, and to what's called endocrine disruptors in our environments. And that is all of the things that we use every single day without even thinking about it. Cleaning supplies, beauty supplies, laundry detergent, air fresheners, all of these things contain these chemicals that are called endocrine disruptors. And what that means is that they disrupt and imbalance our endocrine or our hormonal system. And they most commonly act like estrogens. And estrogen, other than obviously having roles in reproduction, is a growth hormone. That's why it's so important for females and pregnancy. And so it's not just specific to the growth of babies, it's the growth of all tissues. And so if you're getting too much of these growth hormones in too high concentrations, it can cause the growth of things like tumors. And so when we use all that information and we look at our pet population and we say, could any of these things be contributing? 1,000% they can. Because when we think about the most common typical diet that we feed our pets, it is an ultra processed food with lots of synthetic additives, artificial colors, dyes, preservatives. It contains known carcinogens. It is heated multiple times, which we also know causes carcinogens. And we teach our pet parents that not only should they not feed fresh food, but they should only feed them this heavily processed diet exclusively for their entire lives. Take that on top of other practices that we have, like using toxic chemicals all year round, on top of them living sedentary lifestyles and not getting exercise, on top of that, them having stressful lives because they are our companions and they absorb our stress. All of those things make it very clear why we're seeing cancer either at the same rate or at a higher rate than we do in people.
And so with all of those contributing factors within your experience, research, and practice, what would you say are the leading causes of cancer in pets?
So this is where all of us want to find a silver bullet, because then we can address it and eliminate it and feel like we've done a good job.
Right.
I also have many clients who come to me because they do what they think is a really great, and they are doing a really good job of taking care of their pets, feeding an amazing species appropriate diet, minimizing vaccines, being cautious about spay and neuter, keeping toxins out of their home, and their pet will still get cancer. And they'll come to me very frustrated and very upset because they felt like they've done everything right, but they still get a diagnosis of cancer. And this is where, what I teach pet owners about the complex nature of cancer. because it's never going to be one thing. And the thing that causes cancer in one person is going to be different for another. It's why you may have heard of scenarios where you could have a little old lady who drank alcohol and smoked cigarettes her whole life, and she died at the ripe old age of 95 in her sleep. And you can have a young, fit person who works out all the time, eats clean, has never drank alcohol or smoked cigarettes, and will get diagnosed with cancer at 35. It's because of this idea of what we call epigenetics, that we basically are all born with our map, our DNA. And that does contribute to some things. But when we're talking about cancer, it's only 5 to 10% of cancers are driven by our genetics. It's actually 90 to 95% are driven by our environment or our epigenetics. And what that means is that you and I could have the same exact genetic map, but the way that your genes interact with your environment and the way that my genes interact with my environment could be completely different. How they turn on and off our detox pathways, how sensitive we are to chemicals, how we react to vaccines, how we react to stress, how we react to our hormone levels. All of those things are different for every individual and can change how they interact with their environment. And so it becomes this very complex, basically onion with all these layers that, the medical system tries to distill down to this simple thing when our bodies are these very sophisticated, very eloquent, very intelligent machines with many, many layers that are much smarter than us. And so for us to be able to pinpoint one thing is going to be very unlikely. What is going to be much more effective is for us to understand that the prevention of cancer, that the prevention of all chronic diseases all come from the same thing, from starting early and building resilience over time, because these are not things, as we know now, that happen overnight, which means that the most power that we have comes in the long term as this stuff is happening for us to basically turn around these small changes over time that can build up to be very powerful.
So knowing all of this and all the different aspects that can lead to cancer, is there any screening or anything in the works that could help people kind of get a head start on knowing what might not be working for them?
I would love to answer this question because this is what I teach pet owners. This is what my pet cancer prevention course is all about, because this is where we are also lied to. When there is a cancer diagnosis, it is still very dogmatic for a doctor to tell you, when you say to them, "How did this happen?" for them to say it was just bad luck. And that is wrong. And that is not true. And there is also a big difference between what's considered primary prevention of cancer and secondary prevention of cancer. And what most of us have been led to believe is that the only thing that we can do is find cancer early, that we do screening tests, that if we want to prevent colon cancer, we get colonoscopies, that if we want to prevent breast cancer, we get mammograms, that if we want to prevent cancer in animals, we get physical exams. All that is doing is secondary prevention, meaning trying to detect cancer as early as possible. That's not prevention at all. That is early detection. And by the time that we can detect cancer, and this is why we so commonly hear they were healthy, very shortly before a diagnosis, by the time that we can detect cancer with blood work, with CT, with x-rays, with ultrasound, there are already 1 billion cancer cells present. And that's how we know it's taken 10 to 25 years for them to get there, because of studies to figure out how long it takes for those 1 billion cancer cells to divide. And so when we talk about what can we actually do to detect changes, just like you were saying about this chronic inflammation in your kitty's gut, just like we were talking about these things that are happening earlier, instead of us trying to detect cancer earlier, what we should be doing is shifting our focus to what is going wrong in what I call the garden. The chronic disease, the cancer, is the weed. that doesn't grow in a healthy garden. It's only when there are nutritional deficiencies, when there's oxidative stress, when there's parasites, when there's invaders, when there's inflammation, it's only when that happens in the soil that that weed can grow. So instead of us trying to find the weed early, which is still helpful, but what would be even better is for us to start monitoring the soil for health, for nutrition, for lack of parasites, for detox, for toxins. That's what we want to start looking for. So what I teach pet parents to do is how do we evaluate the garden, the soil of your pet for all of those things that could be contributing factors so that we can identify them and minimize them or eliminate them. Because if we keep that soil healthy, it is not going to grow weeds.
Makes sense, yeah.
I love that analogy.
Me too.
To bring in your point from earlier when you mentioned the 95-year-old that drank alcohol and smoked cigarettes and died in her sleep versus the healthy lived lifestyle individual that passes at 35 from cancer, what is the connection between those two different soils? Because the soil for the older lady wasn't great, but somehow she didn't get cancer and lived to be 95.
Yeah. So one of the biggest things that we know is common in cancer patients and a common imbalance and disruption that can lead to cancer is something called methylation. And this was something that I discovered in myself in going down my own journey after my father died, because he died when he was 52. He was a young man and he had very aggressive stage 4 colon cancer. And after he died, I did all the genetic counseling with the big university. They ran all these tests. They took his tumor markers. They did all this stuff. And they said, nothing's wrong with you. You're not going to get this. There's no problem. And then yet I went on to go get a colonoscopy and I had polyps, even though they told me that I should be fine and I had no genetic predisposition. And so as I went down this journey, not just to help my patients, but to help myself and to help my family and to figure out what happened to my dad, it became very, very obvious that I have a couple genetic and epigenetic changes that made me very predisposed to problems. One of them being a celiac, which means I cannot tolerate gluten, which I had never been diagnosed for. And the other one that I have horrible, terrible methylation. And what methylation is a part of your detox system. Basically, there's lots of components of detox in your body, even you breathing, you sweating, your urine, your feces, your liver, your blood, all of those contribute to your detoxification pathways. But there's this specific step in your liver that methylates your toxins to eliminate them from your body. And in cancer patients and people who are predisposed to cancer, it is very common, something like 80%, that they have poor methylation. And this is not just common for cancer. Anybody who is in the autism space, they know that about 90% of children with autism have methylation issues. So it extends to other diseases, neurodegenerative, cardiovascular, hormonal, lots of other diseases have methylation issues, but we know they exist for cancer. And so what it is it's that it's your body really stinks at getting rid of junk. And so basically you have this bucket that has toxins coming in and toxins going out. And instead of the valve at the bottom being open so those toxins can flow out really fast, they are dripping out little by little and basically overflowing into your body. And so I'll share an experience that I had that when I started testing myself for toxins, I specifically tested myself for a chemical called glyphosate. We know it better as Roundup. And at that point, I'd been living a very healthy lifestyle, filtered water, regular sauna use, exercise, all organic food. I thought for sure that my glyphosate levels would be fine. They were 20 times higher than they should have been. And so what I found is that even though I was limiting the amount of junk that I was dumping into my bucket, that valve at the bottom was so small that I essentially can't put anything in the bucket because it will take so long to get rid of it. And so the difference between that 35-year-old that gets cancer and that 95-year-old that doesn't probably heavily weighs on their ability to methylate and detox their body.
And so what do you recommend for those who have methylation difficulties?
So When it comes to methylation and detoxification issues, there are quite a few tests available for people that you can do with your functional medicine doctor. There are some over-the-counter tests that you can order, and you can get reports to get more information about your ability to methylate. Knowledge is power, so knowing, how high risk you are can be helpful to you. It's one piece of a very big, sophisticated puzzle, but it's an important piece to know. In animals, we do not, fortunately, have these kinds of tests. So what then I recommend we do is we be mindful of both things: how much we're dumping into the bucket and how well we're getting rid of the junk that's in the bucket. And so what that looks like is auditing your household for chemicals, auditing your water and your water filtration system, auditing the air close to you and your air filtration system, being mindful of the type of food that you're consuming and the type of toxins that are in them, and then checking the soil for buildup of toxins. Because even when we think that we're giving the right amount of vitamin D, we're giving the right amount of omega fish oils, that we're feeding a species appropriate diet, that we're feeding organic, that we're not exposing our pets to things like pesticides and mold and heavy metals, if they have a crappy bucket like me, they could be holding on to them. And then once we identify those and we investigate, we can put together plans to help with detoxification. And because of the very toxic world that we live in, it is just a reality that all of us need to be doing things to support our methylation and our detoxification, either with eating certain foods. So for example, the foods that support methylation are things like our cruciferous vegetables. So that's like our broccoli and our cauliflower and our Brussels sprouts and our kale and our broccoli sprouts. That's doing things that are methyl donors. So mushrooms, and then for people, our onions and our garlic. That's doing things like supplements like SAMe and other liver support. And it's doing things like other practices that can support methylation, like really good sleep, fasting practices, and stress management. So it's about being really conscious of your risk and how high it is, because most people don't realize that just living in the world we live in is a very dangerous place if you are uneducated about it, and taking that into your own hands to not be scared, but to be empowered and put in an action plan.
Can you mention the tests for the humans?
Yes. So the two that you can do, one is called Nutrition Genome, and all it is a swab. It just checks your DNA. And the other one is called 3x4 genetics, 3x4 genetics. Nutrition Genome, you can purchase yourself over the counter. It's a couple $100s. 3x4 genetics, I'm not positive if they make it direct to consumer yet, or if you need to get it through your doctor. But the goal of both of those tests is that you learn more about yourself. There's also a book that's called Dirty Genes, but genes is spelled Genes. And he talks all about the most important genetic SNPs, like methylation SNPs, to learn about yourself. And he wrote that book back when only 23andMe was really the only way that you could get this information. So you can read that book now with these new tests and get a lot more information about yourself.
All right, perfect. Thank you for sharing that.
Mm-hmm.
And how much do you think an emotional aspect is related to cancer in pets? I know it's a big factor in humans.
Yeah, it's a huge factor in humans. And I think it's a very recognized, it's not discussed because we don't have good scientific ways for us to measure this in our animals. I'll share with you just an anecdote and experience that I had. But in 2020, when everything was at the height of the pandemic and veterinary clinics were shutting down, and we were having to keep pet owners outside and only bring in their animals, and we were in full PPE, and everybody was in masks and gloves, and everybody was getting sick. I remember having conversations with many of my colleagues because they were reaching out to me for help with management of their cancer patients, because so many of their patients who had been doing well for so long were all of a sudden spiraling, and all of a sudden decompensating, and all of a sudden no longer responding to treatment. And I don't think that that was coincidental, because that's when all of their humans went from their day-to-day lives of all being home all the time, super stressed out about a million things. And when we look at the data on the human cancer space, there is absolutely scientific information that is undeniable, insurmountable, that unless you address the emotional component to cancer, you're not going to achieve these long-term remissions and cures, because it's essentially denying a part of the body, right? We have our physical, physiological body. We have our emotional body. That's not a woo-woo thing. We know that our emotion and our thoughts affect our physiology. And then we have this spiritual, energetic component. That's also not woo-woo. That is metaphysics, which we can measure. And so if we deny any one of those bodies and deny treating them, you're leaving a piece out of the puzzle. And so in people, there's quite a bit of evidence about, childhood trauma and links to cancer, adult trauma links to cancer, cortisol levels links to cancer. We know that there are direct cause and effect of emotion and stress in chronic conditions like cancer. And so I have no reason to believe that our pets don't also experience the same thing. The big question that I have, is it their emotions or is it our emotions?
That's a really good question.
Mm-hmm. And so I feel strongly that if someone was interested in addressing this for their pet, they not only need to do things to address their emotions, but they need to do things to address their emotions. Because I have had enough experiences as a pet owner, as someone who's lost their soul dog, as a practitioner, to know that one of the biggest reasons they are here in this world is for us and to help us. And there's no reason for me to believe that that doesn't involve them absorbing some of our energy and our emotions. And so I think that if this is something that an owner is interested in incorporating into part of the treatment plan, that would involve them getting some emotional work as well.
I agree. And I think that is priority and very, very important. And I always say, work with the guardian first and balance out their emotions and kind of get them centered and grounded. And then we can move on to the animal. Because a lot of times once the guardian center themselves and work on what's causing their emotional distress or stress in general, the animal typically 95% of the time will start to improve and behavior changes and health improves. And it usually starts with the guardian. So to answer your question, I think it's a combo probably of guardian's emotions and pet emotions that could cause it. But I do think the majority of it probably comes from the guardian, unless the animal had a massive trauma at some point in their lives, because their body keeps score as well.
Yep.
And those emotions get stuck. So it's important for animals to also receive energy healings that can clear those stuck emotions or blockages, and it will help them tremendously.
Yeah. And I think in the space of cancer specifically, obviously the pet parent is devastated and is very emotional. And this isn't me saying that you're not allowed to have those feelings. Of course you are. You absolutely should have them. But it's also important to be aware of if you are moving through them and processing them, not living in them. Because there have definitely been situations where the pet owner has really struggled to see the silver lining or the positive side of the process at all. That, cancer really, for so many people who have gone through it, either with an animal or with them, a loved one, it really is a gift in the sense that it makes it very easy for you to let go of all the because there's a lot of stuff that doesn't matter anymore when you're talking about the life of a living thing that you love. And so there can be silver linings in this that allow for more connectedness, more presence, more time in a way that maybe you wouldn't have thought about it before. So it can be hard if you allow yourself to get stuck in that anticipatory grief and not move into a place of, let me find what I can find here that is a gift for me. And I think that our pets are much better about that. They don't get stuck in all of that. They're present, in the day. They wake up, they know they're loved. They know they're, living their bucket list. They know they're, doing what it is that they want to be doing because their human loves them so much. And so I think that from this component, especially when talking about it with cancer, it's important to feel how you're feeling and grieve and get support and all of that. But it's also important to be able to find those pieces of joy too, because they also exist even in these moments of heartache and difficulty.
Yeah, that was a hard thing for me to navigate and figure out, because Monkey was my first pet as an adult. Like, I grew up with, I'll say, hundreds of animals: cats, dogs, snakes, mice, rats, you name it. We probably had it. But she was my first as an adult. So it was at that time of like towards the end of her life, and I was in denial of her having it, but it was very difficult for me to be present and still enjoy these moments, because the anticipatory grief for me completely overtook my soul, my being, my essence, my everything. Mm-hmm. And so it was very difficult for me to try to savor those last days and moments. And I would always ask myself, like, how do you still be present and make the most out of every day and every moment when you know what is about to happen, and you never have enough time with the ones you love the most? And it was just like, I felt like I could never get enough time or say enough things. Like, it just always felt like there was something, I don't want to say missing, but kind of.
Yeah.
But I mean, I was just having that mindfulness in that moment, I guess, is present. So we would have conversations every single night. And so I guess I did my best in that moment, but I was very much beside myself, for sure.
Mm-hmm. I mean, it's natural, right? I very much struggled too and needed support from a lot of people too. We're human and we're flawed, and we aren't as good as they are at all of these things with our emotions. And so it's not easy, but it is important to do the best we can. And that's all that we do, right? We show up every day to the best of our ability. And as long as we're trying, then they will always be grateful to us and always forgive us for our humanness.
Right, right. Also, just to touch on how we were talking about mirroring emotions from guardian to animals, I think it's also an eye-opener to realize that sometimes the animals mirror our health issues. So for Monkey, I think it was probably a year or two, maybe 3 after she passed, is when I started to connect the dots even more, because I journal. And that was a big part of me processing her passing. And during one of my moments of journaling, I realized that I think maybe she was mirroring my own digestive system and telling me to look inward and kind of put a magnifying glass on that area, because I've had probably digestive issues my entire life, runs in my family. So it's definitely hereditary. Since then, since I connected those dots, I'm very hyper aware of my digestive system and detoxing and elimination. It's a gift that they give. If you are open to the messages and are aware, you will see yourself in your pet. You will see the mirror. And it can be anything from emotion-based, like anxiety, separation anxiety, fear, reactivity, overprotectiveness, seclusion, or even more serious conditions like digestive challenges, allergies, a limp, and the list goes on, because they are here trying to help you and guide you. And that's one of the ways that they do it.
Yeah, I totally agree that there's some really interesting cases where I've seen things similar like that. So for sure.
I saw a story, I think, on Instagram where there was a dog and his pet parent, and the pet parent had, I think, like a broken leg or something, and the dog would end up picking up his paw, which was the same side. I think it was like the right side or something. So he would pick up his right paw just as the pet parent was not walking on that leg and would hop just as the pet parent was on crutches.
Oh my
so
gosh.
literally mirroring what the pet parent was going through. It was beautiful, but it's pretty mind-blowing at the same time.
It is. And it's, it can seem like a little bit crazy when you first think about it, but then think about their evolution. They went from wild wolves to domesticated dogs because they evolved alongside us. They started out when we were hunter-gatherers. They would eat the leftover carcasses that we would kill. Then, as we became settlers, they started to come closer and we would start to feed them grains because we would start to grow wheat and other crops and we would share them with them. And, there's even papers about the puppy dog eyes, that it's a real thing, that they learn to mirror our facial expressions so that we would feed them.
Right.
And so when we think about their evolution from wild dogs and cats to domesticated pets, it's not that far-fetched to think that they have decades and hundreds of years of intuition and internal guidance to do that, whether it be for their benefit or our benefit. So there is legitimate science behind why they would have learned to do that over, the last couple hundred years.
Yeah. Okay, let's talk about treatment. Many know of the conventional methods, chemo and radiation, but what are we missing? What else is out there that has shown to successfully eradicate cancer in the body? And this can be both conventional and holistic.
Yeah. So the common toolbox that we always think about is our chemotherapy, our radiation, our surgery, and then, our immunotherapy, whether that's like a medication or whether that's an injection. But the thing to really remember about those treatments is they're just focusing on the weed. So they're doing nothing to the soil. So it's not surprising that when we think about cancer, the most common reason that humans and animals die from cancer is what's called metastatic disease, or the spread of cancer. And that's because we are burning, cutting, and poisoning the weed, but we're not doing anything to the soil to prevent it from coming back. And so when we think about why we should expand our toolbox and what other tools should be in our toolbox, it's tools that address the soil. Because we can't heal from the weed if we don't fix the soil that it grew in the first place. All of those drivers that caused it to be there are still going to be there when you remove the tumor. And so, although I would love to be able to tell you, A, B, C, and D are great and they're going to cure cancer, I unfortunately have not figured that out yet. What I have figured out is that every single individual cancer patient is a little onion. And we have to start pulling back the layers one at a time. That usually takes me to a story, much like you said, that started very early in life, with chronic inflammation somewhere, with recurring problems another place, with sensitivities to medications, with chronic allergies. There's usually always something in the history. I have yet to have a single cancer patient ever that doesn't have something in their history, because cancer does not grow in healthy soil, period. So the other tools that we need to use, there are, of course, categories: nutrition, supplements, acupuncture, IV nutrients like vitamin C, the use of oxygen through things like ozone therapy or hyperbaric, light, whether it be laser or broad spectrum light. There's many, many tools that we can reach for. But the way that I approach cancer patients and the way that I train veterinarians to approach cancer patients is that we need to figure out what happened in their story. And we need to figure out why they got cancer. Because although from a conventional perspective, if a patient has lymphoma, they all get the same exact treatment. Monkey's cancer and another kitty cat's cancer are not the same at all. They're completely different, and they're completely driven by different things. And although from a conventional perspective, they're the same and they get the same chemo, from an integrative perspective, their stories could be completely different. And so the best tools to use to treat a patient's cancer are the ones that address the imbalances, toxicities, deficiencies, and damage in that patient's soil. So the way that we identify them is through non-traditional testing. It's why our blood work, our CT or ultrasound does not help us to detect cancer early, because it's not detecting changes in the soil. So using things like nutritional markers, inflammatory markers, assessment of the microbiome, toxin testing, blood sugar testing, using all of those diagnostics to help us to put together the story and help to peel back the layers of the onion, help us to get to the center so that we can actually have long-term control of these tumors.
Out of those markers you just mentioned, are there any at-home tests that can provide that information?
So the cool news about this is that a lot of these companies are actually direct to consumer. Actually, most of them are direct to consumer. Very few of them are available only through your veterinarian. And it's the same on the human side. A lot of these functional diagnostics are direct to consumer. And that's because there's a movement to empower people about their bodies, empower pet owners about their pets' health, to give us more information about truly what's happening in our for real health. And so a lot of those diagnostics are available. I have many of them listed on my website, actually, of the companies that I like to use and how to access them. I also teach my pet parents in my program how to assess all of these tests, how to go through the results of all these tests, what to do with the results of all these tests, because this is the kind of information that pet parents need to be empowered with, because it's going to take a long time to shift the veterinary profession. There's evidence that shows it takes 17 years of the same published data to change clinical practice in medicine. And we are already about 15 to 20 years on average behind human medicine. It is unlikely that there's going to be a shift in how we approach patients from the conventional veterinary side. This is going to have to come from pet parents being educated and empowered. And so oftentimes that requires you to take it into your own hands with the help of someone who can guide you. Yes, most of these toxin testing, omega fatty acid testing, vitamin D testing, inflammatory marker testing, microbiome testing, fecal biomarker testing, all of those are actually available direct to consumer over the counter.
Perfect. And then I was going to ask for the name of those, but if you have them on your website, I will just direct everybody there.
Yeah, I do. I have Dr. Pope's favorite tab on my website, and it links to all of those diagnostic tests.
Okay, perfect. And I will link it in our pod blog, which is our podcast blog, with links to all the good stuff.
Yeah.
So is it possible for you to give examples of holistic treatment options and integrative ways to approach cancer?
Yeah. So I'll give a cancer treatment and a cancer prevention hypothetical situation, because the thing that is important for me to educate pet parents about is that they're basically the same. There are cancer cells forming in our bodies all the time, and our body is divinely sophisticated to handle that. It knows how to. When we get a sunburn, when we smell cigarette smoke, when we inhale cigarette smoke, when we inhale pollution, when we get pesticides on our skin, when we get radiation from flying, all of those things cause DNA damage to our cells. But our body is divinely sophisticated. It knows how to handle that and knows how to repair that damaged DNA and clear it. But when those systems get overridden by all the things that we've talked about, that's when it can no longer repair. That's when those cells go from one cell to a billion cell over time. So when we get to cancer treatment, we're going to have to do a much more intensive protocol. But when we're doing cancer prevention, it's going to be very similar. We're just dealing with fewer cells. And so we don't have to be as intense with time or dose or frequency or the amount of money that we're spending, because the work that we're doing is going to build up and be really profound over time. So let's say that we have a patient with lymphoma who comes into my practice to consult and is undergoing chemotherapy. So they're already getting their what we call cytotoxic therapy, their treatment that kills the tumor. But we know that that's just focusing on the weed. So what are we going to do to help that patient? And every patient's an individual. Every owner's resources of time and money and energy and emotions are different. Every patient's history is different of what they can and they can't tolerate. So all of those things come into play. But generally speaking, when we consult with owners at my practice, we always talk about my pyramid. And it's basically this layer of therapies that we layer in. And this is the same pyramid that I teach the veterinarians about this approach. And it always starts with diet. And then the next step is supplements. And then the next step is targeted supplements based on all of those diagnostics that we do to assess the soil. Then the next step is our immune system and our inflammation treating modalities that are more intensive. And then the top is additional anti-cancer therapies. And the reason that we do it that way is because although our minds and our brains and conventional treatment jumps to the top of the pyramid and kills the cancer cells, we all know and are smarter now to know that that didn't happen overnight. And if we don't lay the foundation of all the other layers of the pyramid, we're never going to get the long-term outcome that we want because we're not helping the body to detoxify. We're not building up the antioxidant stores that we're depleting. We're not reducing the inflammation. We're just adding to it. And we're literally just pouring gasoline on a fire. So we have to lay those other steps in place so that what we're trying to achieve can work long term. And so for most of my patients, they are having nutritional counseling done, helping them to basically move to a minimally processed low carb diet. Most of my patients are getting supporting supplements to help support immune system, decrease inflammation, and support the organs of detoxification. Most of my patients are getting this testing done to figure out, do they need vitamin D? Do they have too many toxins that we need to bind out? Do we have too much inflammation that we need to address? And then many of them are going on to get more intensive treatments like IV vitamin C, ozone therapy, or other anti-cancer treatments like mistletoe or some more aggressive herbs. That cancer treatment protocol is going to be more intensive. They're going to need to see me more often. We're going to do lots of supplements. It's going to be pretty aggressive for 6 to 12 months. But then as time goes on and our cancer screenings keep going and they're doing well and their oncologist is happy, we can do less and less of it. But we never stop. Because what happens on the conventional side is once a chemotherapy protocol is finished, they just say, great, congratulations, chemo's done. We'll see you in a month. Now we just watch and wait until it comes back. That's the time where integrative medicine needs to keep their foot on the gas pedal and keep control of what we've already accomplished. The only difference between that patient and a cancer prevention strategy is that we're doing all the same things. But instead of having to do it as aggressively and as intensely, what we probably do over 6 to 12 months, we're going to do over many years of that patient's life, of intermittently scanning for toxins and treating that, intermittently detoxifying, intermittently giving ozone or vitamin C, intermittently doing fasting or other practices that we know help to clean up those cells that are there. So the toolbox is very similar, whether we're focusing on cancer treatment or cancer prevention. It's just the intensity of which we apply that protocol to the pet.
I love that. That makes a whole lot of sense to me.
Mm-hmm.
And the way you describe it is very clear and concise.
Thank you. Lots of practice.
And so, do you recommend an integrative approach to treating cancer? And for those who aren't familiar with the word integrative, it just means a combo of allopathic conventional therapies and complementary holistic therapies as opposed to solely one or the other.
Yeah. So the way that I like to talk about it, because I, of course, get consults for pet parents that maybe don't want any conventional therapy and they maybe want to go completely holistic. And so the way that I suggest owners determine what they want to do is to not think of it so much as this or that. Just think of it as you have this big toolbox of tools. And in that toolbox is diet, and in that toolbox is ozone, and in that toolbox is supplements, and in that toolbox is chemo and surgery and radiation. The answer is which one is most appropriate to achieve your goals? Because every owner's goals are different. There's some pets that for them to go into the hospital once a week for 25 weeks for a chemo treatment, although that may be good for their cancer, would be very detrimental to their quality of life and would be very stressful to them. And that's just not an ideal situation. So the way that I suggest owners to think about it is not as much about this or that, but as which tools are going to help you to achieve your goals. And generally what that means is you need to have a team. That's truly the best way to go about it. Have a conventional oncologist, have an integrative practitioner, have your primary care vet. You want to have multiple eyes on your pet because they all are going to bring different perspectives and different specialties that can help you. Because when you're dealing with something as serious as a cancer diagnosis, you want to have plenty of people to support you, because there's going to be things that happen and bumps down the road. And so I always suggest that although, yes, it can be overwhelming to get lots of different opinions and too many different recommendations of which way to go, but building that team is really, really important. And the best time to build the team is not after your pet's been diagnosed with cancer, it's before that. And so the thing that I always recommend pet owners to do, although, some of us prefer to kind of not pay attention to things until we have to, I feel very strongly that when it comes to your health, you're going to pay now or you're going to pay later. And that you're going to be in a much better position if you pay attention now. And you build and find those people in your area, in your community. There's so many veterinarians now that offer telehealth that you could access distantly, so that if anything ever happens, you already have those people in place to help you make those decisions, so that you know what all those tools in the toolbox are and you can decide which one is most appropriate for your pet.
Agreed. So well said.
Mm-hmm.
When my little one was diagnosed, I had made an intuitive decision not to put her through the side effects of chemo and radiation. So kind of what you just spoke on.
Yep.
And I opted to fully treat it holistically and solely give herbs.
Yep.
However, I did not have a team. We tried to get her into a holistic veterinarian, but it was a waiting list and she ended up passing before an opening was available. So I was solo, did not know what I was doing fully. I researched online and there was not much out there in treating cancer holistically. The little I did find, I tried. I found a reputable herbal company that offered a lymphoma support bundle, and I got that along with Essiac tea. However, it didn't save her. I know I was in denial of her diagnosis, but I think I was also hoping and praying for a miracle. But I think the unfortunate and harsh reality at that time was nothing would have saved her. Again, there wasn't a whole lot out there at that time on treating cancer holistically.
Yeah.
But that's why, again, I thank you so, so much. And it means the world to me that you're here having this conversation, because I couldn't find anybody like you at the time I needed it. And so I hope by having you here and having this conversation, we will provide others with the information and the person that I didn't have and I couldn't find.
Yeah.
So it means a lot to me. So thank you.
You're welcome. And it's part of the reason that I decided 2 years ago to start teaching, because I can only help so many pets, and my associate who I trained can only help so many pets. And there is such great need for this far and wide, and not just even in our country. I have veterinarians who reach out to me from all over the world. I have clients that reach out from all over the world, because there's need for this everywhere, because cancer is rampant. It's why I've focused on teaching veterinarians to treat cancer while teaching pet parents to prevent it. Because the only true cure for cancer is prevention. And that's not early detection. That is primary prevention of cancer. It's only when we start to understand that we already have the cure for cancer. It's to prevent it. It's not to keep digging for these magical drugs that just prolong life without quality. It's to understand that we already have the cure and that we need to invest our resources in this early prevention to really make a dent and a difference. So I do hope that anybody who's listening, even if you aren't dealing with a current cancer diagnosis, that you find your team now, you educate yourself now, you empower yourself now. And that if you are dealing with a cancer diagnosis, I hope that you are either close enough to myself or any one of my students, because it is so important and there's such a need, and my profession knows it. It's why they're coming to seek this, because they too are frustrated in having clients ask them questions and not being able to help them. So although it's not the majority, we do exist, we are out there, and we grow every day in numbers.
I hope the numbers keep growing because it's such a beautiful and needed resource to have and to know. I wish I had found you back then, but I'm happy to have found you now and share you with the world.
Absolutely. And now, you have this beautiful mission of educating and empowering to, help people going through what you went through, to that never be their story.
That is my mission. I say it all the time. It's to prevent my story from being someone else's story. I just didn't know proper care and nutrition for a feline. And so the thought behind it all is to share what I've learned and the resources so that others may do better for their furry loves. It's kind of like the saying, when we know better, we do better, hopefully anyway. That is in my heart. And you're right. That is my ultimate mission and message.
Mm-hmm.
Here's a straightforward question, which you just touched on. Is cancer curable in pets?
So, absolutely. I say it from the rooftops all the time. The only cure for cancer is prevention, period. There is absolutely situations where we can turn cancer into a chronic disease. We put it in remission and we keep it there. But that's going to be something that for the rest of that pet's life that we have to keep an eye on and we need to be doing something about, because there's a weakness there that we're always going to need to be controlling. And I have plenty of patients who we put in remission and they stayed there long term and they died of other things. But that cancer could have always been a problem if we ignored it too long. So once there is a cancer diagnosis, it is realistic for us to put it in remission and have it become a long-term chronic illness that's managed, that does not take their life, that they live with, they don't die from. But the only cure for cancer is prevention.
And I know we talked about prevention a lot. So the basic question is cancer preventable? But I believe you just answered that with a yes.
Yes, I feel strongly. There's data in people. There's barely any in animals because we aren't studying this at all. But there is absolutely data in people that actually show that with just diet, 40% of cancers are preventable. And when you add in other lifestyle mitigation, including toxin exposure, UV exposure, stuff like that, parasites, infection control, up to 70 to 80% of cancers are preventable.
Wow.
Yep.
We've spoke a lot about how to prevent cancer. Is there anything else you would like to share on the topic?
Yeah. So it is learning about cancer prevention for me is a journey into learning about health in general, because the things that contribute to cancer contribute to all other chronic disease. They contribute to cardiovascular disease, they contribute to diabetes, they contribute to Alzheimer's, they contribute to neurological problems, they contribute to autoimmune disease, they contribute to every other disease you can think of. It's all driven by the same stuff. And so learning about cancer prevention is really just learning about health. And it's a journey that you'll go down where once you start to pull the rug up and see what's under it, you'll never be able to unsee it. And it'll change the way that you look at the world and it'll change the way that you think about things. But none of that has to be scary. It's all to empower you with what really is going on and what's really happening around you so that you can make conscious choices to either engage or not engage with those things around you. Some people feel strongly that they need to live, a 90-10 lifestyle or a 99-1 lifestyle where they only, have 1% of their life that, is quote unquote toxic. But for most people, living an 80-20 lifestyle is going to give you freedom to have pizza once in a while, to be in the sun, to fly on airplanes, to, maybe eat candy every now and then. But 80% of the time, you're going to be informed and knowledge and empowered that the choices that you're making are leading you towards health, not disease, because there is no stagnating in between. You either are making choices that are making you healthier or you're making choices that are making you sicker. There is no other option. Learning about cancer prevention is going to help you to learn about how to empower yourself in all parts of your life so that you can avoid all of that other suffering. Because the thing for me, why I'm so passionate about what I do is because there is nothing that I've come across in my, almost 20 years now of diving into this information that has convinced me otherwise, that if I didn't know this information, that I couldn't have changed the outcome for my dad. Because all of these signs were clear and all of these things that I know now, just like for me. And I hope that in me understanding all of this about myself, that I've prevented myself from the same outcome. Because there were already things happening 10, 15 years ago for me that if I left them ignored, that could have been fulminant cancer by now. And so this is about taking control of your health, because the systems and the bodies that we believe are doing that for us and our pets and advocating for us, some because they're naive and some because they're motivated by other things, they are not the ones that are advocating for our health. And so I believe strongly that it's our job for ourselves and our pets to be informed and empowered, and that going down this journey of education is the only way to really do that.
Yes, education is power. That was the rabbit hole that I went down when she was diagnosed, and that just kind of opened the can of worms, and it started with diet for me. And that's when I learned about species appropriate nutrition and raw feeding, and I connect the dots on that one. And I was like, oh yeah, that makes sense, because that's what they eat in the wild. Why wouldn't they eat that if they're now a domestic animal in your home? You would never see them grazing on a stalk of corn or a wheat field or a pile of sugar. It made sense to me. It was just like, yeah, that's right. That's what they do. And so let me mimic that as close as possible in my own home. So it's been raw food ever since. But it was a rabbit hole. Started with nutrition and then went into herbs and holistic methods and homeopathy and energy healing and anything you can think of. I've researched it or certified in it. There's more to learn. Yeah, agree. Educating yourself, because as I know from experience, not all veterinarians will give you proper information or information in general, and it could be just lack of knowledge or other reasons behind it. But it's important to do your own research and kind of figure it out. So,
absolutely.
Before we go, I want to mention your 501c3 nonprofit organization called PRISM Veterinary Research Institute, which is dedicated to evaluating and legitimizing the benefits of integrative medicine and integrative oncology through treating veterinary patients. This is an amazing initiative, and I would love to hear more about it.
Awesome. So my platform, I realized after becoming an oncologist, is that, with me having those letters at the end of my name and being a specialist, I'm given a platform that other holistic vets might not have. And I also was given this amazing experience of doing a residency of where I was really taught about scientific rigor and clinical trials and evaluating data. But what that beautiful, amazing experience also taught me is that when I finished my residency and I knew the most that I was ever going to know and that anyone knew at that time, that I still knew nothing. And that I still needed to make educated decisions every day because the patient in front of me didn't fit the clinical textbook presentation that I had learned. And I had this moment where I said, well, how is this any different? than all of the other holistic and integrative modalities that I do all the time. And I've spent the last 15 years digging and finding the data that I always was told doesn't exist, that does actually exist, that we were taught isn't there. And so, although data and information does not change people's belief systems, it's their experience that changes their belief systems. It's still very important for us to lead with this scientific information so that people realize that it's not as scary and weird as they think it is, and that it's somewhere that they can get behind too, even if they are a science-minded person. And so where I think that I can make the biggest impact and the biggest difference is bridging those two worlds of scientific rigor with my strong, deep belief system in how these work, and speaking the language between the conventional veterinarians and the integrative veterinarians. So this nonprofit was created as an opportunity to do just that, for us to do scientific clinical trials to prove the efficacy and legitimacy of these therapies, because pharmaceutical companies are not interested in investing in them. There is no proprietary substances that they can get paid for. There is no reason for grants to fund these projects. So instead, we're going to get it other ways, either private donations, either from outside of the box thinking, either from, small funds from the public. But there is a need for this data and this information, and there are people who want to support it. And so the nonprofit was created so that we have a space to do that amongst the groups of us that are already doing this practice and believing this practice, so that we can stand among our colleagues and say, we are specialists too, and this is legitimate too, and this medicine is powerful and should be recognized for what it is.
Amazing. Thank you for that as well.
Yeah.
So everyone, head on over to theholisticfeline.com for this episode's pod blog, where we will have links to all things Dr. Kendra Pope, along with links to all the amazing resources mentioned within the episode. And so before we let you go, are there any final thoughts you'd like to share with us?
Oh, man. Final thoughts. I always have so many. I just am really grateful to any pet parent who, this resonates with. Like, thank you for being open-minded, for coming on this journey, for starting down this path. It can be a scary place. It can be uncomfortable at times. It can be hard for your friends or your veterinarians to shame you or to tell you that it's weird what you're doing. But there is a tribe of people here that are your people. You can come find us. It's getting bigger all the time because people are sick and tired of being sick and tired, and they're sick and tired of their animals being sick and tired. And there is a movement that has already begun and that I know will get bigger and bigger all the time. And so just keep digging for your people. You will find them. We are here, and keep doing what you're doing to advocate for your pets, because they will be forever grateful to you for that.
That's beautiful too. You're just a beautiful human being.
Thank you.
Where can everyone find you, what you offer, your website, social handles, all the good things?
Yes, it's all the same. So very easy. Just drkendrapope.com, drkendrapope.com. My Instagram and Facebook handles are the same, Dr. Kendra Pope, same with the YouTube. So come and find us online, follow along. Any veterinarians who are listening, we offer the training once a year. For my pet parents, we are always enrolling in our pet cancer prevention course. We would love to have you. We have communities for both of those to join afterwards, so that we can continue learning and advocating and kind of building this movement together. We would love to have you. And if you just want to kind of hang out and see what we offer on YouTube and Facebook and Instagram, you can do that too. We're always sharing lots of information.
And Prism?
Yes. So my veterinary practice is Prism Integrative Veterinary Health. It's in Tinton Falls, New Jersey. And anybody who is geographically able or willing to do the drive, come and consult. I am there on a limited basis just because of my teaching engagements, but I have an amazing team that is all trained in my philosophies that help to support all of our patients when I'm not there. And so feel free to come and see any of us, because we're all happy to help you.
Yes. Anyone who is in need of guidance, support, assistance, especially regarding cancer and pets, please do reach out to her practice and team. It's such an important, amazing resource and option to have in your toolbox. You won't regret it, and I wish I had it.
Absolutely.
Dr. Kendra Pope, thank you so much for joining us and shining a light on this unfortunately prevalent disease in our pet and human communities. It's a tragic topic for so many, and I wish I knew then what I know now. Education is how we will change the future.
Absolutely.
And so I, along with Monkey Bean, thank you from the depths of our soul for what you do and for being here for all of us.
You're so welcome. I'm so happy to do it and honored to be in this position.
Thank you for listening to the Holistic Feline and Friends podcast. It is created, hosted, produced, and released with love, and my hope is you learn something along the way. When we know better, we do better. Please share your knowledge and our podcast with others. For more educational content, follow us on your favorite podcast platform, as well as Instagram at The Holistic Feline and online at theholisticfeline.com, where you will also find our blog that includes corresponding posts for each podcast episode with links to all the good stuff. Thank you again. We'll see you in the next episode.
The Holistic Feline and Friends podcast, website, blog, and socials are for informational and educational purposes only. All information, suggestions, recommendations, or comments, whether by written, verbal, audio, or otherwise, either direct, indirect, or association, is not a substitute for professional veterinary care. Please provide your pets with a minimum annual professional veterinary visit, and more often when health concerns arise. The Holistic Feline, Angela Warwick, and all guests and associates are speaking from experience and education. Please continue your research and form your own opinion. This is in no way a means to diagnose.